Well, May is Mental Health Awareness Month. The Texas Child Health Access through Telemedicine program will provide services for children and adolescents, all referred by their schools.
And so joining us in today's Leading Essay segment is Rena Pardawala, a specialist with that program through UT Health San Antonio. Good morning. Thank you so much for joining us.
Good morning. Thanks for having me.
Right off the bat, how big of an issue do we see in terms of mental health here in our community?
Yeah, mental health is a huge issue in our community. I think the best way to describe it is through our program. So our program commenced TCHAT, Texas Child Health Access through Telemedicine. We commenced in September of 2020. And through the 2020-2021 school year, we were partnered with about 10 districts or so, and we received 1,200 referrals. That's a lot of referrals. Now, this school year, 2021-2022, we have partnered with about 37 school districts now, and we have received about 1,800 referrals, and the school year is still not over. So it is a major issue, and it's growing.
It's really just come to the forefront where I think everyone is noticing it. It's on people's minds. So what are the various types of mental illnesses that families and parents should be aware of?
Yeah, so there are a number of different mental health issues. I think what we see the most with kids is we see a lot of anxiety, especially after the pandemic. We see depression. There's a lot of PTSD we are also noticing. I think more than ever, I've been working in psychiatry and in child adolescent since 2015. I'm seeing a lot of self-harming behavior, which is worse than ever before. And there's a lot of suicidal ideations, a lot of suicidal thoughts. Of course, we always see inattention, lack of focus, oppositional defiance. We're seeing a lot more of eating disorders as well now. So there are definitely things that have grown significantly, especially in the last few years.
When parents see those signs of kids harming themselves, cutting themselves, what should their first step be to do?
Yeah, the first step they need to do is get in contact with a mental or behavioral health care provider. Of course, in our program, we are partnered with 37 districts. Families can easily speak to their school counselors as long as that school is partnered with our program, and they can be immediately referred to our program. One of the great things about our program is we provide very quick access to care. And so we can see kiddos the same day, we can see them within 72 hours. So we are a great referral source, but getting a hold of any mental health care provider, or if the child needs emergent services, to get them to an emergency room or a crisis center for mental health.
I want to take a step back for a second. Before they even get to the self-harming phase, what are some important signs to look out for to be more proactive and preventative for parents?
Absolutely. One of the biggest things we want to look for as parents is isolation. I think that's one of the first signs. We start noticing our kiddos are lacking interest in doing things. They're lacking energy. They're kind of hiding from family members. They no longer want to go to family events. I think one of the big things we look for at the schools with the teachers is they start noticing these bigger behavioral changes. So students are all of a sudden, not focusing the way they used to focus, or their school grades are dropping, or maybe they're isolating even at school. They're not hanging out with their usual group of friends. I think one of the biggest things that we hear from kids nowadays are how lonely they are. So when kids start talking about loneliness, I think that's one of the first signs we really need to look at what's going on with our child. There also actually is sleep issues. When you start noticing that your child is not sleeping as well, that's a really big indicator that maybe something is going on. Let me talk to them more about this. Let me ask them what's happening.
Well, thank you so much. All this information just so incredibly important, and all of our viewers, you can find all of it later on our website this morning at ksat.com. Thank you so much for making time for us this morning.
Yep, thank you for having me.
Time now, 8:11, 65 degrees out.